Welcome to Wednesday's edition of COVID-19. A growing number of countries are opting for tougher measures to tackle resurgences, urging for collective public action against the pandemic. Now, we have more on this later on the program. We start now with the broader coverage with our Kwon So-ah. Now, so there's been a rebound here in Korea in the absence of the weekend factor.
Right, Sunny, we're seeing an increase by more than 500 cases compared to Monday and Tuesday. 1,725 cases were reported as of 12 a.m. this Wednesday, which includes 1,664 domestic cases and 61 infections from abroad. Now, if we take a look at our graph, we do see that numbers have been at above 1,000 now for 4 weeks, but there's a slight improvement if we take a look at the weekly figures here of Wednesday. Last Wednesday, that's when we had a record high in daily infections. So we are seeing a slight decrease here when it comes to the on-week tally. Now, meanwhile, the country has accumulated 203,926 infections in total, with 2,106 COVID-19 related fatalities. Meanwhile, on the vaccination front, we just hit that milestone of over 20 million people who received at least one dose of COVID-19 vaccine. That milestone we had yesterday. Now we are at 20.1 million, and also 7.2 million people have been fully vaccinated. That's around 14.2% of the nation's population. The government, meanwhile, is expected to make an announcement this Friday regarding social distancing measures, which are likely to be extended, along with the possibility of even tougher regulations if the spread continues as it is right now. So officials are continuing to highlight the risks of increased traveling across the nation. Here's more.
Nationwide movement last week rose 3.6% from the previous week, a second straight weekly rise, while movement was little changed in the capital region, with a 0.8% rise last week. The situation in the non-capital regions is serious, with a 6.4% increase.
In fact, the proportion of infections outside the capital region is again close to 40% here. This is the proportion of the domestic cases on a Wednesday as of 12 a.m. and that is equivalent to 628 infections counted in the non-capital regions, which is the highest number that area is seeing ever since the fourth wave of the virus here in the country. So let's go over to our graph, our map that is. We're seeing over 400 infections in both Gyeonggi-do province and Seoul, also a rise in Incheon. So we are seeing also higher figures in the capital region. But another concern here down in the southeastern part of the city, both Busan and Gyeongsangnam-do province are seeing triple-digit figures of daily cases.
Right, so and I hear we've also marked a grim milestone on the international front with regard to the total number of COVID-19 cases.
Yes, Sunny. A year and 7 months since the first confirmed case, 200 million people around the world have been infected with COVID-19. And out of those, 180.5 million have fully recovered. It took just around half a year to get from the 100 million to the 200 million mark, and that despite the rollout of vaccines. So far, around 15% of the world has been inoculated. And here's the infection number as of noon Korea time, which stands at 200.2 million, while we also have 4.2 million COVID-19 related deaths. And as for some recent developments on the COVID-19 front abroad, the Delta variant is spreading across China, even to places that were almost virus-free for months. Wuhan City, the very first epicenter of COVID-19, is no exception. Authorities have announced to test its entire population of 11 million. Concerns are mounting in the country hosting the biggest sports event amid the pandemic, with Japan reporting more than 12,000 cases on a Wednesday local time. Tokyo over 3,700. The number of patients directly linked to the games has risen by 18, raising the total to 294. The U.S., the country with the highest figure of total cases and deaths, has now vaccinated 70% of its adults with at least one shot and donated 110 million vaccine doses abroad. Nevertheless, it's dealing with resurgences in cases and hospitalizations at over 50,000. Africa is meanwhile struggling with a fast rising death toll that surged by over 80% within the last 4 weeks, according to the World Health Organization, especially due to the Delta variant. The highly contagious strain has been detected in more than 130 territories. And finally, let's take a look at the numbers here. In 1 year and 7 months, the U.S. has hit 36 million cases in total. And we've got 7 countries that have accumulated 5 million cases of the COVID-19 virus, and also 19 countries around the world that have over 2 million infections. Let's hope for a slowdown in these numbers. But for now, that's all I have for today. And back to you, Sunny.
All right, so thank you so much. I'll see you on Thursday.
My pleasure.
Right, staying on the international front, health authorities in neighboring Japan are urging for public vigilance as they battle thousands of daily infections amid the 2020 Summer Olympics. For more on this, I have Walter Sim live on the line. Walter, it's good to see you again.
Good to see you again, Sunny.
Right, Walter, let's begin with the latest on the COVID-19 situation there in Japan.
Well, as was introduced earlier, Japan recorded 12,000 cases yesterday with nearly 4,000 in Tokyo. So this comes despite a slight drop on Monday, and case numbers tend to be lower at the start of the week with fewer tests done over the weekend. I believe it might be the same at South Korea as well. So I think for a better sense of what the situation is, we have to look at the numbers that start coming in from today, and I wouldn't be surprised if new records are being set again later this week. With this surge in cases also comes in controversy. So Prime Minister Suga on Monday announced a shift in policy where hospitals will only admit the very sickest or those who are at the highest risk of developing severe conditions. But this policy was on paper to protect medical institutions from being overburdened, from collapse. But yet this also raises a lot of concerns, no least because as many as 84 COVID-19 patients who were recuperating at home died suddenly between January and June. So there is no saying at all that someone who is recovering at home will suddenly see their condition take a turn for the worse, and before they could even be hospitalized, pass away. I'm sure there's also a lot of interest in the COVID situation within the Olympic Village as well. As was mentioned earlier, the overall cases remain low. But as of this morning, there are concerns rising of a potential first-class within the Olympic Village. This comes from the Greek artistic swimming team, of which there are 12 members, 5 of whom have tested positive.
I see. Walter, there have been complaints about quarantine facilities among athletes and Olympic personnel who test positive or are contact traced. What has been fueling the discontent?
Well, I think this mostly stems from their unhappiness over the quarantine conditions. So they are apparently reportedly being quarantined in hotel rooms that do not have windows that can be open for natural ventilation. But then again, that's actually pretty common for hotels in Japan, especially in budget business hotels. So I suppose their complaints expose the difference in attitudes really between COVID-19, between isolation practices, and between the treatment of COVID-19 patients internationally.
I see. Walter, on the political front then, we are hearing of talk about possible legal revisions in Japan to introduce COVID-19 lockdowns in the country. Could you tell us a bit about this?
Right. So there has been a lot of debate on this front. So some within the ruling Liberal Democratic Party say that it's wanting to learn from the prolonged pandemic is the importance of being forward-looking, of being proactive measures. And it's actually quite astounding that 16 months since the first state of emergency was declared in April last year, Japan until now still has no means to implement stricter lockdown measures than what's happening now. So the government was also saying that they are unable to call for one because of constitutional guarantees of the right to freedom that must first be amended. But then, of course, this is also going to be very politically controversial since the Prime Minister must call a general election by October 21st. So the public will definitely not look very kindly to a lockdown, especially given the protracted emergency curbs. And also because countries elsewhere are gradually starting to open up. But of course, the main difference between Japan as well as overseas countries is that Japan's vaccination is not progressing fast enough. So the government is very reluctant to implement a full lockdown because of the impact on consumption, the impact on the economy, and that's why they have not taken stronger measures to shut down business like department stores, like cinemas, and ironically have also provided very little support for the travel industry. But of course, this on the flip side gives people the incentive to patronize these shops, gives people the incentive to travel because after all the businesses are being kept open, and this leads to my earlier response that the general public has been very nonchalant. There's alarm over the surging numbers, but yet there is a lot of mixed signals being sent. So experts have blamed the Olympics for blunting the sense of urgency, and I cannot say that experts are wrong. So the government wants the public to avoid non-essential travel, non-essential outings, but the government has not done enough to define what exactly non-essential means. And the government has actually allowed the display of the Olympic cauldron in public. So that, to me, actually gives the public a reason to gather around the cauldron for photos because, well, the public will justify this as an essential activity after all because, well, it's once in a lifetime that Olympics is being held here.
Of course. I see. All right, Walt, as always, thank you very much for your time and your thoughts.
No worries. Thanks so much, Sunny.
All right, back on the local front, authorities have announced their first findings of the Delta Plus variant here in the country. And for more on this, I have our G. Abby Lee here in the studio with me. Welcome, G.
Hello, Sunny. So the buzzword during yesterday's Q&A session was the new Delta Plus variant. In today's segment, let's look into the origins of that term and the status of the vaccine availability for this month. Korea has reported its first 2 cases of the new Delta Plus COVID-19 variant amid the 4th wave of infections. The Delta Plus variant is a sublineage of the Delta variant first identified in India and features a spike protein mutation called K417N. A handful of other countries have also reported the new variant, such as the UK and Portugal. Going back to the 2 individuals, who are they and how did they get infected? One of them is a man in his 40s who had no recent travel record. While the source of his infection is under investigation, his son has also tested positive. The second case was identified in a traveler who returned from the United States. Despite what the term might suggest, the Delta Plus is not any more powerful than the other variants. Here is KDC Director Park Young-jun speaking at Tuesday's briefing.
We'd like to point out that Delta Plus is not a medical term, but rather a choice of words intended to provide an easier level of general understanding. Officially, we characterize them as sublineages of the AY Delta, namely AY 1, 2, and 3.
Right. Meanwhile, on the inoculation front, G, what's the latest with regard to vaccine shipments into the country?
It's going as scheduled, apart from the slight delay from Moderna due to the unspecified production issues identified last month. Earlier Wednesday, Prime Minister Kim Boo-kyum once again underscored the importance of vaccinations in curbing the latest outbreak.
It is clear that the fundamental solution to this crisis is to achieve herd immunity through vaccines, given the current spread of the coronavirus nationwide.
On Tuesday and on this Wednesday, around 2.4 million AstraZeneca vaccine doses left the SK Bioscience factory in the southeastern city of Andong. Also on this Wednesday, more than 2.5 million Pfizer doses arrived at the Incheon International Airport.
I see. And before you go, Jay, do tell us a bit about vaccine appointments for the broader public.
Sure, let's first hear directly from the agency.
8월 9일 20시부터
Online registration for vaccine appointments will open next week for those between 18 and 49, from 8 p.m. on August 9th to 6 p.m. on August 19th. You can book your appointments on set dates that are determined by the last digit of your date of birth.
For example, from 8 p.m. on August 9th through 6 p.m. the next day, people who are born on the 9th, 19th, or 29th can make their vaccine appointments. This system might seem unfamiliar to some of our viewers, but it's actually quite common here in the country. Korea has used this type of rotation system on many occasions. For example, it restricted vehicles on the road for certain days depending on their license plate numbers to ease traffic congestions. The idea of using a rotation system for vaccine bookings is to prevent overcrowding on the booking site, which could lead to a server crash. If you're unable to secure an appointment within those dates, you can still book the appointments at a later date, but details on that timeline has yet to be announced. That's all for me today. I'll be back same time next week.
All right, Ji, as always, thank you very much for the coverage.
Thanks for having me.
Right, it's been about a month since the start of our fourth wave, and healthcare workers at temporary screening centres have been battling the blistering heat and more to keep the virus in check. Do take a look.
As South Korea enters a fourth wave of the pandemic, more and more people are coming to testing sites to get tested for the virus. And in July, here at Seoul Station alone, a daily average of 960 people came here to get tested. As South Korea raised social distancing in Seoul to its highest level, the average number of tests conducted on weekends in this screening center has been increased from 400 to 700. Temperatures exceed 35 in Seoul and 40 inside the testing site, but medical professionals are in their full protective gear, including face shields and medical rubber gloves.
검사복을 입었을 때 아무래도 안에 땀도 좀 더 차고 장갑이라든지 착용할 때 좀 땀이 그 전보다는 많이 차서 그 점이 좀 힘든 것 같아요.
요새 날씨가 자꾸 최고 기온에 찍어서 가만히 여기 서 있기만 해도 등에 막 땀이 주르르 흐르고 마스크 안엔 지금 땀 범벅이거든요, 이미.
To beat the heat, from air conditioners to ice vests, various cooling equipment is installed inside the testing center. But it's not enough to cope with the scorching heat. And this is no exception for people waiting in line. The center is lending sun umbrellas to people, but these don't do much.
저도 잠깐 서 있는 거 더운데 저렇게 다 방호복 입고 일하시는 게 너무 더워 보이고 저희를 위해 수고해 주는 게 너무 감사한 것 같아요.
So I have my protective suit ready. I'm gonna try this on and see what it is like working in a long coat sleeve under this scorching hot weather. I started to sweat buckets within a few minutes. In the aftermath of the COVID-19 pandemic, responders and public health providers struggle with the dual burden of long working hours and heat waves. Meanwhile, in Seochogu district, a drive-through testing site is crowded with a massive influx of citizens.
날씨도 덥고 오래 기다린다고 그래서 이용하게 됐습니다.
날이 너무 더워가지고 그래도 여기 좀 차 안에서 받으면 좀 시원할 것 같아가지고 왔는데 너무 많은 분들 고생하시는 것 같아가지고 좀 죄송해요.
Many people are visiting the testing site because it's convenient in a way that they can wait inside their cars, but it is still overloading medical staff members.
폭염이 심해가지고 더위에 취약하고 그리고 매연이나 자동차에서 나오는 열기나 그런 것들에 더 취약한 게 있고.
Each testing site has 8 to 12 medical professionals working in shifts, though during rush hour it would need more staff members. Also, it's not just medical professionals who are struggling with the sizzling heat. Others in charge of testing sites, such as district office employees, are dealing with hot weather, but a few air coolers are never enough for them to cope with the intense summer heat.
인프라에 관련된 부분이기 때문에 이 부분은 당장 개선하기 좀 어려운 측면이 있는 것도 어쩔 수 없는 현실입니다만 가능하면 기존에 있는 여러 공공 시설 중에 실내에서 이 검사를 할 수 있는 여러 가지 이제 그런 부분을 보완하는 것이 가장 필요하겠고요. 두 번째는 그러면 근무 시간을 장시간 오랫동안 근무하는 것보다는 이제 교대 근무를 계속 할 수 있도록 하는 것도 굉장히 좋은 방법이 되겠죠. 지금은 역시 그 인력 확보가 가장 중요한 상황이 되겠습니다.
Medical professionals and staff members are working around the clock despite their heavy workload and, of course, scorching weather conditions. We definitely need to improve their working conditions, such as by setting up more testing sites. This has been 신새벽.
확산세가 반전되지 않는다면 정부는 더 강력한 방역 조치를 고려하지 않을 수 없습니다.
CDC recommends fully vaccinated people wear masks in public indoor settings to help prevent the spread of the Delta variant and protect others.
246,000 Californians should be vaccinated. And if they're not vaccinated and cannot verify that they've been vaccinated, we are requiring that they get tested.
C'est une grosse entrave à la liberté tout court. Voilà, si maintenant il faut un pass sanitaire pour aller faire ses courses, aller au cinéma, profiter de la vie.
Authorities here and elsewhere are working to contain resurgences led largely by the Delta variant, but public fatigue and inconsistent social restrictions are adding on to the burden of tackling this pandemic. For more, I have Dr. David Kwak from Suncheon University. Welcome back, Dr. Kwak.
Good afternoon.
Right, now, Dr. Kwak, with the weekend factor out of the way, Korea recorded 1,725 cases on this Wednesday. Authorities have been saying that current restrictions will be eased once our tally drops to pre-fourth wave levels. What are your thoughts on this?
Well, it'll be hard to do, as we have seen from prior huge waves. Usually when it goes up exponentially in a very acute fashion. But what it takes to bring it down back is time and effort by the medical sector, by the national population, by everybody basically. So it takes months at a time to bring the waves down back to the original low numbers that it used to have. It'll be probably the same with this situation, but one thing is added here is that from prior cluster infections, we used to see one or a couple of huge cluster infections that created the wave. But this time around, I think it's more of a domestic cases spreading throughout the nation that's causing the huge wave, which will be harder to contain. Number one, because it's harder to trace all of them back. Number two, we don't exactly know where it came from, so we cannot speculate where it is going to spread out to. So it'll be harder to do. So some people, I guess, are saying that it's unrealistic that we sort of anticipate to bring it all the way back down to the low numbers that we used to have. But it needs to be brought back down so that we could continue the lives that we used to have before the social distancing level 4. So we just have to do our best to bring it down. But we also have to expect that it might take a little longer than expected.
Right. Countries with high vaccination numbers, Dr. Kwak, have reimposed indoor mask mandates. Does this imply that with inoculation alone, we cannot prevent the Delta variant?
Well, yes and no to that. This is mainly due to a huge cluster infection that happened in the US, where a huge gathering ended up in people having infections despite having completed their own vaccinations. It seems like 2/3 or the majority of the population that were at the gathering were infected despite having had completion of their vaccinations 2 weeks or more prior to the gathering. And from that incident, I think the CDC was able to deduct that even having vaccinations may not completely block further transmission by the people. But they were still having protection from the vaccines in a way that they haven't become severe, or there wasn't death cases due to the cluster infection. It tells us that these vaccinations still protect us. Also, another recent study that is out of Canada showed great efficacy of any types of vaccines that protected all of us who are even injected with even one shot to have at least 85 or above percentage of protection against mortality or severe disease courses. So that tells us these vaccines still do protect us, even against Delta variants. But they may not be so protective against blocking from transmission completely. So we would still have to keep the social distancing. We would still have to keep wearing the mask for future proof of the deal. But in essence, vaccines are still necessary because they still do provide us great protection against severe disease.
Right, which is probably why COVID-19 vaccination is becoming a necessity to access public venues elsewhere. Now, for more on this new normal, I have Radwan over in Saudi Arabia live on the line. Pleasure to have you with us, Radwan.
Hi, good morning.
Right, and also joining the session virtually is Michael Barbero over in France. Michael, welcome again.
Hello, Sunny.
Right, Radwan, we'll start with you then. Amid the spread of the Delta variant, Saudi Arabia restricted last month's Hajj to its vaccinated residents. Let's begin with the latest on the Delta outbreak in Saudi Arabia.
Well, so far, we can thankfully say that there have not been any cases of COVID Delta variant specifically. The Minister of Health has mentioned the success of the Hajj pilgrimage rituals, and this is due to very strict measures that were taken. Social distancing were adhered to, and of course, all those who were attending the pilgrimage were vaccinated with both doses. And not only pilgrims were vaccinated, but everyone involved. We're talking from volunteers to health professionals to even campaign leaders. Everyone had to be vaccinated. Everyone needed to make sure that they were safe and they were further away from any kind of infection possible.
I see. In contrast, over in France, Michael, I understand the country has been witnessing a frightening spike in daily infections fueled by the Delta. Could you tell us more about that?
Yeah, I'm afraid the situation is quite different, as you were saying, from Saudi Arabia. Yeah, the Delta variant has completely taken over in France. The vast majority of cases of new cases are Delta, and this has caused a massive spike, as you say. I think in about 1 month we went from 2,000 new cases per day to about 26,000 new cases per day. The good news is that the vaccination campaign is making progress, and it's having an impact in the sense that if you look at early May, when the number of new cases was similar, about 25,000 new cases a day, hospitals were swamped. We had hundreds of that every day. Right now we have dozens of that every day, and we have about 8,000 hospital beds taken by COVID patients versus about 30,000 back in May. So that's the good news, at least.
I see. Ruwan, starting this month, residents in Saudi Arabia must be fully inoculated to enter all public places, and starting next Monday, only fully vaccinated citizens will be allowed to travel overseas. Could you tell us a bit more about the COVID-19 vaccine mandate in Saudi Arabia?
Well, as you mentioned, everyone, all residents in the kingdom must be vaccinated in order to enter any kind of commercial establishments, government and private establishments as well. Those who do not will not be allowed naturally. The reason why is they need to understand, people need to understand that this is to curb the spread of COVID, to decrease basically the incidence of any kind of infection. The strict measures are not new. This has been happening since last March, basically, as soon as the pandemic was announced. Strict measures were taken throughout the country, and we have not ceased or we have not eased these restrictions unless we know that the pandemic will be announced that it's not a pandemic anymore. But again, this is just not new. As of next week, only those who are fully vaccinated will be allowed to travel outside of the country. And this is, again, to ensure that once they reach whatever destination they're going to, they're safe and they will not be carrying any kind of infection with them.
Ruwan, what has been the public response to that vaccine mandate in Saudi
Everyone
Arabia?
is understanding that this is a necessity. Vaccinations, actually, the vaccine rollout has been doing very well. We are vaccinated about 350,000 as an average per day. So far, 8.7 million have received double doses. We're talking about 28.2 million doses so far, at least 28.2 million doses have been administered to residents of the kingdom. And we have to understand that everyone can get the vaccine for free. We're talking residents, citizens, expats, including illegal residents in the country.
Right. Meanwhile, Mikhail, in France, I understand public protests continue there against the requirement of vaccinations for entry into public places. Do you tell us a bit more about this, please?
Yeah. So first of all, let me say that the majority of the French actually approve of these measures. It's called health pass here in France. And right now, you already have to show proof of vaccination or a negative test to enter museums, or cinemas, theaters. If, the Parliament approved a new bill, and now we're awaiting a verdict from the Constitutional Council, which come actually tomorrow, so pretty soon. If the Council gives a green light, starting in just a few days, probably on the 9th of August, the health pass will be required for restaurants and cafes as well, among other things. The majority of the French, as I was saying, about 60-70% of respondents actually agree with these measures. There is a vocal minority, but still a minority, that, as you were saying, is taking to the streets more and more regularly. I think there have been growing rallies over 3 weekends in a row. And you can find all sorts of people among these rallies, from the hardline no-vaxxers who are just, who believe conspiracy theories, who believe that these measures are just a way to benefit big pharma, to people who are not necessarily against the vaccines themselves, but who are against the idea of the government imposing a mandatory vaccination. Bearing in mind that France is one of the most vaccine skeptical countries in the world, if not the most skeptical country in the world historically.
Right. And staying with that, Dr. Kwak, some medical experts are claiming that vaccine mandates may serve to promote vaccine hesitancy. What are your thoughts on this?
Well, so I'm trying to take a different approach to this. When there's a mandate of certain measure on people, obviously there would be a setback, and there would be a certain portion of people that would fight against it. Because the idea solely itself is sort of kind of making people do stuff that they don't want to. But it'll be obviously much, much wiser to receive vaccine at this point of time. So I think a better approach to this is educating people better, letting people know why they need the vaccines if they haven't been told already, but also showing them graphically what happens to people that hasn't received vaccine and were infected. The media could also show them what sort of percentage of protection these vaccines provide in what areas, such as providing protection from death, providing protection from severe disease, having to stay much shorter time, even if they were having breakthrough infections despite the vaccinations, at the social facilities, isolation facilities. Those stuff need to be told in a better way to the general public, so that they have better idea, better understanding, and are convinced to go ahead and get the vaccines. As you've mentioned, mandating such routine would be kind of hard to do, because, as Mikhail also said, there are even people who oppose completely against the idea of getting any types of vaccines. So we cannot physically have them vaccinated by law. But I guess the better approach, and more efficient approach, I personally think, would be to better educate all the people, so that we could have more people come up to and have the mind to receive the vaccine for themselves.
Right. And Mikhail, how are pundits that in Europe assessing the potential impact of requiring vaccinations on efforts to perhaps contain the outbreak in Europe?
Well, I guess it depends on what kind of pundits you're talking about. Health experts tend to agree, I'm speaking for France, specifically the country I live in, that when it comes to the vaccination campaign, these measures are actually quite helpful. Making the vaccine more or less mandatory is actually boosting the vaccination campaign. We've seen that in France, like over the 7 days following the French president's announcement, we had about 4 million people booking their vaccines online. So this is clearly boosting the campaign already. An entirely different story is the political cost for whichever government approves these kind of measures. In France, even though, as I was saying, most people actually agree with these measures, the big risk for political experts is that Macron triggers a new wave of endemic protests week after week, becoming more and more violent, more and more radical, exactly like it happened in late 2018, early 2019 with the yellow vest protests. So that's the biggest political risk, and that's clearly also, by the way, why so many governments are, for example, France, Italy, but really any European government is not yet imposing mandatory vaccines. They're always saying what we are imposing is a health pass, which means a vaccine or a negative COVID test. Of course, if you make those COVID tests no longer free of charge, then this amounts to a de facto mandatory vaccination for most people, at least.
Right. Ruwan, what has been the impact of tough COVID-19 measures on Saudi Arabia's efforts to contain the pandemic in that part of the world?
Well, we do need to assert the fact that in order to curb the spread, we're also going digital. We have gone digital since the beginning of the pandemic. We have applications such as Tawakkalna, which shows the health status of the citizen or the resident in the kingdom. We have applications such as Tabaud, which also indicates the occurrence of any infections surrounding you in the area, for example, simply by using Wi-Fi and Bluetooth. You can't enter any of these establishments that I mentioned earlier before without showing your health status on the application itself. This way, you don't need, it's simply going digital with everything. Even booking a pilgrimage or prayer at the Grand Mosque in Mecca or the Prophet's Mosque in Medina are required through an application. Everything has gone digital, and everyone is required to basically download the app. It shows the health status, whether they're recovered, 1 dose of the vaccine or double dose of the vaccine, or even infected. And the amount of public adherence and social distancing measures that are being adhered to is very much welcome. You can see every day that people understand the fact that this is not just necessary, this is also important for students to come back to school, for people to get back to work normally and safely. All these measures are being taken and adhered to from the very beginning. The COVID levels, the COVID infection, on a daily basis have not risen above the 1,200 case mark, and this is due to the public adherence. Yes, we would like to see less numbers, but with the public adherence socially, they will understand that the numbers will go down gradually.
Right. Meanwhile, Dr. Kwak, a new US study has found that fewer than 1% of fully inoculated people have experienced breakthrough infections. Now, what are the implications of this study amid ongoing concerns over the effectiveness of some of our vaccines?
Well, it tells us that even if some types of vaccines have been shown to be less effective than the other types, it still protects us in a great amount. I would like to mention here also that with the 2 Delta Plus variant cases that happened very recently in Korea, one of them had been vaccinated with AstraZeneca, two AstraZeneca shots completely, and he or she was actually showing a very, very mild symptom, almost minimal. So it does tell us that whatever the types of vaccines that they use, it will still provide us great protection, not just from blocking the transmission totally, but at least in a sense that it protects us not to have it in a severe form of the disease and not dying from it. So once again, I just need to reiterate it at this point that vaccines do provide us great protection, if not almost 100%.
Right. And staying with vaccination, Rowan, When is Saudi Arabia expected to reach herd immunity?
Well, I'm no health expert, and I cannot speak on this topic without referring back to our health officials. Health officials and authorities have reiterated the fact that it's very important for us as citizens and residents of the kingdom to adhere to social distancing measures. And they've urged citizens and everyone to go ahead and register for the vaccine. Note that the number of appointments per day has been increasing. The priority has now been shifted to students as schools are set to start by the end of this month. We can't really say when herd immunity will be achieved. Some experts say October, some people say by the end of the year, but it doesn't really matter. All that matters is that people adhere to social distancing measures, precautionary measures, of course, ensure that they listen. And of course, if they don't do that, they will be fined with amounts that are not really necessary. It's a very simple equation. Adhere to social distancing measures, keep the mask on, take the vaccine, and you will be fine.
Right. And Mikhail, I should have asked you this earlier, but what has been the government's stance on some public discord over its vaccination requirement or the health pass that you mentioned?
Well, basically, it's a double approach. On one hand, they're trying to do de la pédagogie, as they say in French. So they're trying to convince, it's the carrot system, right? Trying to convince people that this is very much needed and that there are no inherent risks in the vaccines that are being used in France. On the other hand, and by the way, this is also being done on plenty of social media. Macron recently published videos on TikTok and Instagram to address the young, more specifically, which are the target of this new push, this new vaccination push. On the other hand, they're actually adopting the government is adopting a more, let's say, a harsher language more recently against hardline no-vaxxers, essentially trying to isolate them from the rest of the population.
I see. And Dr. Kwak, amid plans for booster shots within highly vaccinated nations, the World Health Organization has called for the sharing of these vaccines with countries in need to ensure that the birth of new variants does not occur. Where do you stand on this debate?
We probably talked about this a couple of weeks ago, and I strongly stand on the side of sharing with the countries that need it the most at this point. Those countries that are well off, the countries that are already reaching herd immunity, don't quite need it as much as the countries that are currently lacking them. And obviously, all these variants that are evading the effects of vaccines come from those countries, and it'll turn around, and in the future, it'll later come back to those developed countries to attack them with evasions from the vaccines. Obviously, I am hoping that we will be looking at other picture, hopefully in the near future, with not just the vaccines, but other possible treatment regimens. But until that happens, vaccine is the only sword that we can fight with against this gruesome virus. And these countries that are coming up with these very gruesome variants are lacking them, and we need them to have at least mild protection as well, so to have the global protection from the virus. So I do stand with the idea that we need to share these vaccines with the countries that need them the most right now.
I see. All right, Dr. Kwak, as always, thank you very much for your insights.
Thank you.
Rawan over in Saudi Arabia, thank you very much for your time. And Mikhail in France, thank you for being with us today.
Thank you.
Right, now here on the local front polls show most people are in favour of level 4 restrictions, the highest in our framework to stem the latest spread of the virus. Do stay safe and see you on Thursday.